Hello, everyone, and welcome to the Oklahoma News Report. I'm Rich Lenz. Our first newscast of 2022 begins in much the same way that we ended our last newscast of 2021, discussing a massive surge in the Omicron variant, and now the new concerns over a lack of access to testing and an alarming statewide shortage of key therapeutics. This, as our daily 7-day rolling average of new cases is a staggering 4,094 per day as of Friday. We begin with reporter Jason Doyle.
Rich, as indicated by the increased number of infections in Oklahoma and around the country, testing and treatment have become top priorities. Oklahomans should be able to find tests, but treatments like monoclonal antibodies are starting to run short. Oklahoma State Department of Health officials are keeping a close eye on the supply of monoclonal antibodies it receives to distribute to the dozens of infusion centers around the state. However, because the U.S. Health and Human Services has slowed allocations, Oklahoma may not have enough monoclonal antibody treatments to meet the need beyond this month.
As with other states, Oklahoma's recent allocation of monoclonal antibodies has been insufficient to assure adequate supply moving forward. We are actively pursuing all measures with our federal partners at HHS to increase our allocations, but as it stands now, the current supply in the state, along with expected deliveries from the next cycle allocations, are anticipated to be depleted this month.
Part of that is due to the Omicron variant beginning to overtake the Delta variant in Oklahoma.
Variant sequencing at the Public Health Lab of most recent specimens collected over the holiday shows a mix of 57% Omicron and 43% Delta. And it is likely that that Omicron variant will continue to increase in Oklahoma, as we have seen in other states and countries.
Past monoclonal antibody treatments like Regeneron and BAM aren't as effective against Omicron.
Our system still has Regeneron and BAM, but we just don't think it's going to be effective for most patients. We don't have Cetuximab, which is in short supply. It's relatively new. It's not been distributed as widely as the other two.
The newly approved treatment just isn't readily available, even as demand around the U.S. grows.
It's just not as much of it around, and we're all waiting for it. Plus, as you know, the East Coast, Northeast has had huge outbreaks, much higher population incidence than we have. So they're getting prioritized for some of those treatments.
The shortage is being felt in Oklahoma hospitals, helping to provide the treatment to newly infected COVID patients.
Many of our hospitals have monoclonal antibody clinics, but as demand has increased and our supply has diminished, and then with the new Omicron, we know that it's not effective to the traditional ones that we've had on the shelf, that this is a problem. So I want to reiterate with what Dr. Bratzler said. There is a priority on who will get these monoclonals in limited supply.
The COVID antiviral pills by Pfizer and Merck recently won emergency use authorization from the FDA. They also are in short supply.
With respect to the antivirals, they are not variant specific, which is good news. They appear to be equally effective, at least currently, for all the variants that are out there. So they're brand new. They were just FDA approved. So it's just taking time to get them out, into pharmacies.
People are searching out COVID tests at hospitals, too. That has created an extra burden on the healthcare system.
As we see patients come to the hospital for a variety of situations, and that we're asking patients not to come just for testing. There are alternate sites.
To help, the State Department of Health is expanding testing throughout the state.
As we see a rise in cases, we have increased access to testing through expanded hours and additional sites around the state.
The Oklahoma City County Health Department, which works separately from the State Health Department, also expanding opportunities for tests starting next week.
Starting next Monday, our Northeast location at 2700 Northeast 63rd will be doing a drive-through testing.
Since the holidays, demand for tests are up.
Our testing volume has gone up exponentially. We're, this location that we're at right now, we're upwards of 150 a day. And so, like 3 or 4 weeks ago, we were doing maybe 20 a day.
Emmy Labs confirms an increase in demand at their testing sites.
Before Christmas, we were averaging around 200 tests a day. Now we're somewhere in the ballpark. It depends on the day, but it's somewhere between 2,000 and 3,000 a day. across the 6 different metro locations that we're at.
Amy Labs is part of a public-private partnership with the State Department of Health to provide free tests and vaccinations.
Really, it was about turnaround time on testing. Was what got us started in all this. We started originally partnering with Norman Regional Hospital, doing testing for them, and then a lot of different hospitals around the metro started sending tests to us because we had fast turnaround times.
These labs provide the PCR test, which is considered the best at detecting any COVID virus. If you're looking for an at-home test, those are hard to come by.
It's really that at-home test is the one that we're seeing literally fly off the shelf. And that's the one that most of the concern is. But for the entry points or the access points that we have around the state to help people get tested, we have supplies to support those.
President Biden recently announced a federal program to provide 500 million at-home tests, but how those will be distributed has not been defined.
We don't know exactly how that program will work. We've been inquiring about it from our federal partners. We don't know if that will involve us in that logistics chain to where we will kind of help with the allocations or distribution of that program. We're still waiting to see.
Reed says the state does have plenty of testing supplies on hand. Testing for COVID in another way, the Oklahoma Blood Institute is providing its donors antibody tests this month.
Yeah, it's a new antibody test starting January 3rd through January 31st. Prior COVID screenings for antibodies only would detect natural infection with the COVID-19 virus. This new antibody test will also detect the vaccines.
While it isn't recommended using an antibody test to find out if you have COVID, it does provide information for medical decisions.
And this will also give more information to donors whether they're deciding to get the booster shot or the vaccine in general, because they'll be able to see if they have any antibodies at all.
On Friday morning, the Oklahoma Department of Health announced they had secured an additional 1,000 doses each of Regeneron and BAM monoclonal antibody treatments. It was mentioned earlier the daily case counts are soaring. Here are some of the other weekly COVID numbers. For the first time in months, hospitalizations have reached over 1,000. As of Friday, the total was 1,081, with 277 of those in ICU. We had 173 deaths over the past week, totaling nearly 12,600. And more than 57% of eligible Oklahomans have been fully vaccinated.